Good afternoon. My name is Taylor Bryan Turner, Assistant Regional Administrator for SAMHSA, Region 1, New England. It is my pleasure to tell you about the healthcare workers and educators addressing and reducing trauma collective. I think the name says it all. But first, I'd love to tell you a little bit about why the Heart Collective is so near and dear to me. So here I am, 5 years old, living in Brooklyn, New York, living in the projects or affordable housing, only child at the time before my two younger sisters come along. So I'm living my best life. When I was 8, my parents headed to New England to escape the Bedford-Stuyvesant projects for a safer life, a more equitable life, and access to economic mobility. Things were going according to plan, and Mom and Dad had great jobs. But when I was 15, there was a mass shooting at a local bar in Providence, Rhode Island, and a person under the influence shot through windows of a bar and several people were harmed. My father sat at the bar when a person got up, and a gunshot wound caused him to be wheelchair bound, a quadriplegic, paralyzed from the neck down for the rest of his life. His biggest fear was being incarcerated just for living as a Black man, and now here he is, a prisoner in his own body for the rest of his life. This caused me to be a young nurse, physical therapist, and extremely adaptable. I had to grow up fast, started working right away to help Mom, and went to 3 different high schools because we had to move around a lot to provide that accessible housing to accommodate my father's needs. These are multiple traumas and had a major impact on my family, and I want there to be accessible mental health supports to all children, and the best place I can think of is in our schools. These are the resources that I did not have access to. So why did we convene the Heart Collective? Well, COVID-19 increased the need for school mental health, stress, anxiety, depression, suicide ideation, and substance use among youth are at an all-time high. Schools are underfunded. We wanted to work with SAMHSA because SAMHSA was funding the community health centers who are caring for youth in our communities. And we wanted to work with the schools because that's where our children spend most of their days. And while we all want the same things for our youth, we knew access and coming to consensus can be hard. So I approached the New England Mental Health Technology Transfer Center for their school mental health initiative because of their work promoting community-based collaborations to reduce trauma through school mental health systems using this compassionate school mental health model. With the Heart Collective, we helped revise and refine this plan. The statement of values you see here provides all members of the community, including the youth and their families, an opportunity to be heard and contribute to the mission and the model. So HEART was formed. HEART is an intentional collaboration between the MHTTC, SAMHSA, Health Resources and Services Administration, and SAMHSA to bring mental health supports to schools in an effort to train, support, and strengthen compassionate social and emotional learning. There are barriers to school perspective, as well as the healthcare center and lived experience perspective. To go over some of the barriers that get in the way of us collectively doing this work, we had to bring together regional leaders in education, healthcare, family advocacy, and lived experience to identify the barriers, to learn from the experts in community on what's working well and how HEART might address these challenges and turn them into solutions with SAMHSA's grantees, and then drawing in the other TTCs to help realize it. Now let me be clear, FQHCs and schools looked forward to working together, and some were already doing the work, but HEART really thrives to perfect those relationships. So barriers included funding, mental health supports, lack of information, staff burnout, a unison glossary was needed early on, and pushback on roles and who should be responsible for what. Many of these barriers are unique, but many also overlap. Also, diversity in lived experience was a critical component on developing and executing a plan. The most critical component of this work remains our youth, the very audience we wish to reach, gain trust, and transform. So it was imperative that we keep that engagement open and sacred as we work to alleviate their stresses and anxieties and traumas. Many children's homes have been turned upside down during the pandemic, as well as teachers and providers, due to the many lives, about 900,000, we've lost during the pandemic. But the time for innovation and collaboration could not be more prevalent. And since HEART has formed, we have improved the Compassionate School mental health model. We've convened a committee to build a community of educators and counselors who share best practices, and created a virtual community of practice for school-based mental health that is accessible to all. Please visit our new HEART website, where you will find information on our mental health awareness campaign and gain access to our webinars. In fact, later today at 4 o'clock, you can join the conversation about what funding and logistics considerations have worked for others. I feel very fortunate that I get to work on this team and help to provide some form of safety for children experiencing trauma during grade school, as I once did. And I'm truly grateful for each member of HEART for providing a space for compassionate and social emotional learning. On behalf of the MHTTC, SAMHSA, HRSA, and the entire HEART Collective, thank you for helping to amplify this work and the opportunity to share with you today. Please enjoy the rest of the conference and have a good afternoon.